We have things in common. Perhaps we can summarize them by saying that what we all really care about is that public health research is done for the benefit of the populations. So I'd like to carry on with and nourish this discussion, talking about environmental health issues.
Donc, sous l'angle de la description et de la réflexion sur le
By
dialogue
describing and thinking
la
about the
recherche
dialogue
et
between
la décision dans le
research
champ de la santé
and
environnementale. Et
decision-making
plutôt que de passer en
processes
revue
in
un grand nombre de
environmental
centres
health
environnementaux
issues.
et de me demander
So
si la science est prise
I
en
was
compte
asked
ou
if
non,
science is taken into
j'ai
consideration
changé
or
d'ailleurs un petit
not
peu
in this
mon titre
area.
pour essayer d'identifier
And
ce qui
what I
pourrait
tried to
être
do
des
is to
conditions
identify the
nécessaires pour
conditions
favoriser
which
ce
should
dialogue et
be
permettre une
necessary
meilleure
to foster this
divulgation de la
dialogue
science
and
dans les
improve the
décisions
use of
publiques et
science
peut-être
in,
aussi,
in public decision making.
je passerai moins de temps là-dessus,
I'm not going to
réfléchir
spend
bien sûr à la
that much
nature
time
de nos
on
productions
this.
scientifiques,
So
la
the
plus
nature
pertinente pour
of
les décideurs.
scientific productions
C'est sûr que
for the
pour revenir
benefit
sur un
of
point qu'on a
decision
abordé ce
makers.
matin, la
So
question
coming back to a point that we
d'avoir
covered this
des
morning,
décideurs
a
qui
question
connaissent
about
mieux la
whether
science ou ont une
decision
appétence
makers
pour la
know
science symétriquement
science
d'avoir des scientifiques
well and
plus
vice
familiers des
versa
enjeux de la
for
décision,
scientists with regard to public
va dans le
decision
bon
making?
sens.
Do they both
Alors,
know each other's fields that
il est
well
clair, et
or
donc je vais
not?
pas prendre trop
So I'm
d'exemples,
not going to take too many
qu'il y
examples
a des questions
about
de santé
this,
environnementale pour
but we do
lesquelles
have environmental science
la,
questions
les connaissances sont mal prises en compte.
where knowledge is not
Le
very
métal
well
que vous voyez
appreciated.
ici, c'est du
So you can
cadmium.
see the metal here in the picture is
Un
cadmium.
syndicat de médecins généralistes nous a
A
alerté
union
au
of
début du mois
GPs
de juin
alerted
2025
us in
en
June
disant qu'il
2025
posait un problème
saying
sanitaire
that
majeur en
cadmium poses
France
a major
du fait de
health
sa
problem in
contamination
France
des
due to the
niveaux
fact
élevés
that it
observés à la fois dans
has
l'alimentation, y compris l'alimentation des jeunes
contaminated
enfants, et
food
de
at a
sa
high
présence
level,
dans l'organisme de
and
toute la
that
population, donc
is
les
in
jeunes
that it is
enfants.
present in the
Par ailleurs,
bodies of
effectivement,
young people across the
les
country.
agences sanitaires comme
So
l'ANSES
the
nous
health
disent
agencies
qu'il ne faudrait pas dépasser dans
have
les
told
engrais
us
phosphatés, qui sont une des sources majeures
that
de cadmium. Donc il y a une source principale, c'est
fertilizers are one of the major
le
sources of
biodéchant.
cadmium. So that's a
L'ANSES
real
recommande de ne pas dépasser
area that needs
20
to be looked
unités
at
comme
in more
seuil
detail. So we
unité,
need to
et
not go
également
over,
pour
say, 20
France et en
units.
Europe,
And
l'aide tolère jusqu'à
this
60, ce qui est une
is a real hot
illustration
topic
d'un
in France as well as the rest of Europe.
manque
So
de
20
considération de
is the
la
limit, or
science
60,
dans la
depending on how you
décision
look at it. And so
publique.
there's a real lack of appreciation about how this is
Et à
taken into
prééminence
consideration
d'autres
in public
que
policy and decision
considérations
making.
scientifiques. Alors c'est un exemple parmi beaucoup d'autres.
So this is just
Au
one
sein de ce
example
qu'on
among
appelle
many
l'exposome,
others.
c'est-à-dire l'ensemble des facteurs
Next up, I'm going to
environnementaux
look
qui
at
toute
the
nature peuvent être
exposomes. That means
exposés sous la
all of
conception
the different
jusqu'à la fin de la
things that we
vie.
can be exposed to in our environment, and then
Cela
whether they
inclut
encounter,
des dizaines de
that whether they
milliers, je ne
affect
sais pas très bien
life,
combien, mais
biology,
probablement
and health.
pas loin de
So
100 000
first of all,
facteurs de nature
chemical
chimique, surtout
factors.
si on inclut les facteurs d'origine naturelle, les
There
médicaments, les
might
pesticides.
be natural
On
ones, there
compte les
might
23
be
000 environ produits chimiques
medication-based
identifiés par
ones,
la
there
loi
might
qui
be
européenne REACH,
fertilizer, and
les facteurs
so
physiques comme le bruit
and that's
et
one thing. And
l'éloignement,
then
les
there
facteurs
are
météorologiques et
physical
donc aussi le
factors
changement
such as
climatique qui est derrière, les facteurs
climate change,
psychosociaux,
the
les facteurs
weather, and then there are
qu'on peut qualifier
psychosocial
de
factors,
comportementaux et qui
behavioral
sont aussi liés à
factors,
notre environnement.
which are also linked to
Bien
our
sûr, les agents
environment.
biologiques influençant
And
la
then there are, of
santé
course,
et les
biological
infections.
factors which do affect our
Donc, je ne
health.
parlerai
So
pas
things such as
ici et la
infection.
plupart des exemples que je prendrai sont
Most
plutôt dans le champ
of
que je
the
connais mieux des facteurs
examples that I'm
chimiques
going to talk about are
qui
the
ont
ones I
des
know the
différences
best.
au niveau
So
de leur
that's chemical
prise
factors.
en compte et dans la prise de décision avec les
And they
agents
need to be
biologiques,
taken into consideration
notamment du
alongside
fait de la
biological factors,
temporalité
especially
des effets.
because
On est souvent
the
sur des effets
temporality of
d'exposition
the
chronique
effects can lead
moins
to
fréquemment, des
chronic
effets à très court terme,
exposures,
comme on
which
les
don't
observe
actually
pour
appear
les agents
in the
infectieux
short term, they
souvent,
appear in the
puisque
long
les agents
term.
infectieux ont bien sûr des effets à très long terme. On est sur des liens causaux qui sont plus
There are
difficiles à
causal
établir et
relationships
sur les
which have been
pathologies
established. And with regard
multifactorielles.
to pathology
Ce qui
specifically, so there's a
est
multi-factor
un des défis pour
reason to this. It's one of the
la
main
décision
challenges
publique,
for
probablement.
public decision making, I
Un
think.
autre défi, c'est bien sûr la
Another
multiplicité
challenge is, of
de
course,
ces facteurs.
the
Comme je
wide
l'ai noté,
range
la haute
of these
dimension
factors,
de
the
l'exposome.
high
Si on
level
les gère un
of
par un, ça implique
exposomes,
beaucoup de
and
décisions
this
potentiellement pour les
includes
décideurs.
many different
Dans le
decisions
contexte où
that
notre
decision makers need to
environnement
make. So we have in the environment say, since the Industrial Revolution, which is becoming more and more difficult and more challenging. So let's say that in the 1850s, there were far fewer houses compared to today in the modern world. And the decision that needs to be taken in many different areas, and this really goes beyond the competency of the Ministry of Health. The fact that they traditionally focus on individual risk factors, such as tobacco, alcohol, and infections, maybe diet too, and of course, environmental health decisions affect everything. So, for example, agriculture, I've already spoken about, diet, pesticides, and fertilizers. Then there's the environment, transport, such as air pollution, education, industry, and economy, and so on and so forth. So there's a wide number of sectors that are involved in this debate. It's really not up to just simply one ministry, the Ministry of Health, to have to deal with all of that. It'll be far too complicated for them. And this doesn't help. As we have mentioned, the economy we have is mainly based on growth and competitivity. If we're listening to what people in the country and the EU are saying, it's really all about growth and competitivity. I don't necessarily understand this in great detail, but they are saying that, for example, challenges to do with specific products getting to market are difficult. We would need to simplify things for them to be able to get their products to market more easily. So this might be medication or pesticide or a consumption product which we might be exposed to. So before this product gets authorization, the decision makers think that we can still have this competitivity and more complicated context with more and more substances, all by at the same time simplifying the regulations. So we mustn't increase the rules. And if we do create new laws, then we might get rid of old laws. All of this creates tension, which is very, very difficult to conciliate. Irrespective of all of that, I would like to suggest several different things. So, for example, how can science be considered in managing environmental health issues? And I would like to identify several different major conditions. First of all, we want laws to be clear in the way that they manage risk in their scope and take scientific knowledge into account. Next up, we want scientific knowledge to be available. So we're talking about mainstreaming knowledge and know-how. We want there to be a strong environmental health research monitoring. And as we all know, we also need the relevant institutions to punish people who don't respect the law. So I'm talking about the justice system and the police force. Another point, which would be number one, even if there's no real hierarchy, and that would be to have general principles above the laws, perhaps more constitutionally, about societal values, which is pivotal, and the way that science should or not be taken into consideration in these high-level decisions. So I just wanted to present to you all of these points. They are relatively independent, but let's start with the general principles. So in environmental sciences, we do have some general principles. So I'm sure you've already heard about many of them. We have the principle of protecting health. Sometimes I call it prevention, but they might be a little bit ambiguous because it also sort of describes source-based action rather than upstream action, so before the source. There needs to be a balance between prevention and the application of another principle, which is precaution. The payer must, the polluter must pay, excuse me. That's another principle. And so this one here, DDP, devoir de vigilance, means the duty to be vigilant. So due diligence, essentially, the due diligence principle. We'll get there in the end. It's a little bit complicated, if you like, but it's a little bit simpler in English. Some issues are less explicit in the Constitution and in decision making, and these are the way that we should or not take into account the opinions of economic stakeholders and employment stakeholders. All of this is in the mind of the decision makers. We mustn't forget social inequalities, of course, which we've already mentioned, and there are many other principles as well. But I wanted to really just expose these ones here because I think that these do exist on the European scale, very high up in the Treaty of European Functioning. So I'm going to quote Article 191, which states that the Union policy on the environment should contribute to pursuing the following objectives: preserving, protecting, and improving the equality of the environment, protecting human health, etc., etc. Next, any decision should aim at a high level of protection. It should also be based on the precautionary principle. It needs to be able to be rectified at the source, and it should all be about polluters having to pay. One of the other principles that I already mentioned. So these decisions must be based on technical and scientific knowledge. Scientific knowledge is important and they need to be accounted for, especially with regard to the potential benefits and costs of action or inaction. We've spoken about the economy, but we mustn't forget the social development of the Union as a whole and the balanced development of its regions. So many different principles in this treaty of functioning. But what is really important is that they've not actually been defined that precisely. And in certain cases, the degree of application is missing, and we need to focus more on the precautionary principle, especially. It's one of the texts of this functioning treaty, which has been published. It's very vast, but the principles do remain nonetheless. So behind all of that, we do have principles which tell us that if we are in a situation with uncertainty or risk, then we must protect and preserve, and we must act to either prevent or protect by applying scientific knowledge. Science needs to be considered, and we must protect the environment and health at a high level. Even when there is no uncertainty, but the level of risk is high, we must act nonetheless. And that is linked to the fact that we've been given the principle of precaution. So there is an area where the risk is actually very low or theoretically quite low. It can be difficult to quantify, and there might be a lot of uncertainty or not. In any case, inaction could be justified. So what are the precautions? Let me just illustrate this point. Prevention is whereby we could define the technical characteristics of a cable by way of pre-marketing tests. I think that we all agree that it wouldn't be a particularly great idea to stay for too long under this concrete block. So we could just simply get out of the way. That would be a precautionary measure. Just have to step to one side. In any case, that's how the principle of precaution was defined. So as you can see, where there is a threat or serious or irreversible. So where there are threats of serious or irreversible damage, lack of full scientific certainty should not be used as a reason for postponing cost-effective measures to prevent environmental degradation. So this is from the Rio Convention 1992.
We also have the principle of the polluter pays, the polluter pays principle.
Bien sûr, toutes ces décisions et la prise en compte de la science.
Of course, all of these decisions and the consideration of science can only take place if there's no conflict of interest at any of the stages, any steps. The decision must not be disrupted by any conflict of interest. Let me come to the issue of regulations, looking at the example of air quality, where we have a French law. I won't read it in detail. It says that the state and local authorities and the private sector must contribute to a policy, the objective of which is to implement the recognized right of everyone to breathe air that is not dangerous for the health. It's a rather complicated way of expressing this, although we're not legal experts, maybe that's why. But the aim is fairly clear. We don't want to have air causing a problem for people's health. This is difficult because we know there are a lot of deaths caused by problems with air quality. After that, it talks about air quality standards that have to be determined after obtaining the opinion of the agency in charge of environmental health in accordance with what the EU says, and also in application of the World Health Organization. If you ask three bodies for their advice, they're not necessarily going to say the same thing. Do you take the average of the something in the middle or the best possible answer? It's not very clear. Then it says that the standards have to be regularly reevaluated, taking into account the results of medical and epidemiological studies. I'm an epidemiologist. I'm very happy with that. We have to listen to epidemiology. Okay, fine. But then it has to be done regularly. Is it every 20 years, every 3 years? So we can see this in a positive light. We have all of the key words we're looking for, but it's also rather ambiguous. When we look at the standards, EU has a standard at 25 milligrams on average. The US are at 9. And what science says, which has been reviewed by the WHO, is that you should be at 5. This is a particular matter of annual levels. So we have the impression here that there's some incoherence here, that a decision was made to bring it down to 10 milligram in 2030. Then we have directives on other subjects such as water quality, drinking water quality. Here you have the same situation. It says that drinking water has to meet the quality limits defined by the Minister for Health. So either the Minister for Health has a scientific advisor who knows everything, and so why not state that explicitly? It does. There's no idea about nothing to do with the regular revision or of these standards. These parameters are not really monitored because it's very expensive to monitor these. And here again, it's ambiguous. The same thing for diet as well. It says that protection has to be guaranteed by carrying out risk analysis. Is it really going to use DALIs? Is it going to be using some other kind of parameter? Again, it's not clear. So science is present, but it's very ambiguous in these laws. The role is ambiguous. And it's just to show you a positive example. For me, what a law should look like, this is an example of the EU law on pesticides, which tells us that an active substance can only be approved if it hasn't been classified as mutagen, carcinogen, or toxic for reproduction. Category 1A, 1B. 1A is it's certainly carcinogenous and unless the exposure is negligible, it then says. So here it says if the substance is dangerous and causes cancer, it cannot be used. Even if it's not certain but presumed, it still must not be authorized. For me, this corresponds to the precautionary principle. So this is a good law. Doesn't mean we're completely protected from these substances. The problem is identifying the mutagens, carcinogens, and toxic-free productions. If you exclude the academic studies when you evaluate a carcinogenic product, then you neutralize the law. And this is the current situation. Then, of course, at the level of the law, the decision makers must not have any conflict of interest. A lot of progress has been made in that area, in the agencies and also in the decision makers themselves. It's not easy for them because they spend a lot of time working with different people. And sometimes we get the impression they spend more time working with the industrial companies than working with NGOs or patient representatives. And they don't really much have incentive to listen to all of the different stakeholders. I'll go very quickly through the science just to say that we have to have information to take the decision, have to know whether the substance is carcinogenic. We have to know what the risk is, what is the impact on air pollution. Then we quantify it in an economic way, why not? And then we can compare it with the risk management options. All of this is useful in order to take the decision. We don't need to have all of that to make the decision. Sometimes the decision is just taken on the basis of hazard identification, as I just showed with the pesticides. Of course, for this to be realistic and to actually take place, the financing for the research has to be in proportion to the number of problems that arise. We don't have any mechanism that links funding of research in non-environmental health or public health to the number of new problems or new questions. There is an example, it was the example of addictions, where there is a fund for action against addictions, which is funded by a tax on tobacco, which means there is certain proportionality between the consumption of addictive substances and funding of research on addictions. But in other cases, we don't really have that link. Of course, these decisions have to be taken into account, but it's not easy for the legal system to fully understand and take account of scientific knowledge, quite simply because the causal logic, the causal framework of the magistrates is not the same as that of the scientists. We will say 8% of deaths in the area are attributed to air pollution, whereas justice will tend to look at individual cases. Did air pollution call Mrs. X or Mr. Y? Scientists won't be able to say that. You have exposure markers, but you don't have a marker indicating that particular factor killed that person. We know usually it's several factors. But we also know that our justice system in Europe is less offensive and less corrective than it is elsewhere. For example, Dieselgate. Volkswagen had to pay 15 billion after an out-of-court agreement in the US. It's much less that had to be paid to Europe. To sum up, I think in terms of general principles which are essential, which say that science has to be included in decisions, in Europe at least, we have a lot of texts, a lot of principles. We don't need to increase that, but we need to have the implementing decrees, and so these principles actually are involved in decision-making. As we've seen, the laws tend to be rather weak and not very clear, and not really connected to these general principles that are clear, and there's no real requirement for them to consider science. I'm not saying science isn't considered at all. This is what I understand from the principles defined at the level of the EU. There's a lack of coherence here. Of course, science has to be strong, and you have to have the right funding according to need for the research, and you have to have the means to compensate for reasons occasions when this is not done properly, and you have to be able to have systems for disseminating this knowledge. Thank you very much.